Amelia's story is one of a successful, bright individual who relapses into an addiction she felt she had recovered from in her youth. How common are scenarios like this one in real life?
Relapses are very common. People don't realize that treating addiction isn't like fixing a broken finger and you take the cast off and everything is fine. Relapse is a part of treatment, and people do well and they recover, and they can recover completely, and we need storylines like this to portray that.
So the EIC is an organization that you can really get behind?
I'm very supportive of EIC. This is about the fourth time that I've been associated with them. It's an honor for us, particularly out of the White House, to be a part of these accurate portrayals of substance abuse issues and, of course, mental health issues. So we're big supporters.
Gil, why is it important to challenge stereotypes about addiction by showcasing a character like Amelia?
If we don't show people the accurate and true facts, which is that addiction is a disease, that it can be treated, that people can actually recover, then I think we're deluding the public that there is some magic, simple answer to what our drug problem is in this country, which is one that is incredibly complex. You know, I often get asked what is our national drug problem, and we have a series of regional drug problems. We don't have a national drug problem. We have methamphetamine in the West, and we have prescription drugs in many other places. So people need to recognize that there's a whole host of substances out there. The other part that we don't often recognize is that prevention works, that treatment can be effective, and that all of this can still keep a community safe and it can save money.
How can well-researched and accurate portrayals like that of Caterina as Amelia Shepherd help to raise awareness about prescription drug abuse?
Well, people get so much information through the media, through television, and when these are done in this fair and accurate depiction, it makes a huge difference to the understanding that the American public has. I truly think it has the power to actually change the way elected officials, policymakers take a look at this problem. And of course, we know that if we put time and money and effort into treatment and into prevention, we can make people healthier. We know two things about prescription drugs. One is that people don't perceive them as dangerous because they say, well, after all, it's a prescription. And yet these can be as addictive and frankly as deadly as something sold in a piece of tinfoil from behind a gas station. The other part is that we haven't really understood the dangers that exist in the medicine cabinets. And so cleaning out a medicine cabinet of some of those unused, outdated, very powerful painkillers can make a big difference in keeping them out of the wrong hands. I think the first and most important part is the education and the awareness, not only from patients who may be prescribed these prescription drugs and need to know that they can be addictive, habit-forming, even deadly, but also the education that needs to occur with the prescribers. When I've talked to doctors across this country and asked them what level of training and information they got in med school about addiction, about pain management, about tolerance and dependence, it's almost nothing. So we need to increase prescriber education also.